Hello, class. For our presentation, our topic is autism, and it's based on the pages that we read this week. And this is a picture of autism with a bunch of words that people kind of think of when they first think of autism. Autism is a developmental disability significantly affecting verbal and nonverbal communication and social interaction, generally evident before age 3, that adversely affects a child's educational performance. Other characteristics often associated with autism are engagement in repetitive activities and stereotype movements, resistance to environmental change or change in daily routines, and unusual responses to sensory experiences. Our etiology, which is the cause or set of causes of a disease or a condition, is that children with autism in the U.S. are rising, and boys are most likely to have it. And some studies suggest that vaccines may be at a fault, and older men may be more likely to produce autistic children. From our book, you guys might have seen these numbers, and the number of students who have autism is 406,957, and that the percentage of all students receiving IDEA services is 7.03, and from ages 6 to 21, it's 0.59, and we wanted to find a kind of more updated percentage of this and number, and we didn't find one close to 2017, but we found one from 2014 that found out that 1 in 68 children would have an autism spectrum disorder. And it's been found, like I said earlier, it's more in boys we've been finding, and there's been studies on, as there was 1 in 42 boys and 1 in 189 girls. So that's kind of a big gap that they've been finding. So the eligibility criteria is that 1, the student exhibits impairments in communication. And this kind of means that they lack nonverbal communication skills or use abnormal nonverbal communication. They're unable to initiate or sustain conversation with others. And number 2 would be the student exhibits difficulties in forming appropriate relationships. And this has been described as a lack of awareness of others' feelings, and they're absent or abnormal social play, and they don't have the ability to make friends easily. For number 3, the student exhibits unusual responses to sensory information, and this just means that they respond unusually and not like your average child. Number 4 is the student exhibits impairments in cognitive development. And what this means is that the student has difficulty with concrete versus abstract thinking, awareness, judgment, and/or the ability to generalize. Number 5 is the student exhibits an abnormal range or activities. And this just means that they have a restricted range of interest or a preoccupation with one narrow interest. 6 would be the student has been previously diagnosed with autism by a qualified professional. And this just means that a licensed clinical psychologist, psychiatric, clinical neuropsychologist, and other professionals have previously diagnosed the student, which was accompanied by a report with recommendation for instruction. And then the last one, number 7, the disability is adversely affecting the student's educational performance. And this has been stated that the IEP committee uses multiple sources of information to determine that educational performance is adversely affected and is not primarily due to an emotional disability. So that's a little bit about the eligibility criteria. The learning characteristics would be developmental disability characterized by impairments in communication, learning, reciprocal social interaction. This is usually identified in infancy and early childhood. and that it affects their educational performance. And like we said earlier, they have a narrow range of interest and they have a low threshold for difficulty in dealing with stress. For recommended practices, it said that we should adjust teaching to foster student success, and that does the student need extra help, and to adjust physical environment and adjust expectations, and that every student is different. Even if you have multiple students with autism, they have different characteristics and things and how they act and respond to certain situations and activities. And so it's just changing our teaching for what the student needs. And we just wanted to leave you with this overall message that if they can't learn the way we teach the way they learn. I have a brother who was autistic, and I say that he was because you wouldn't even be able to tell if he had autism. He functions like a normal human being. He has served a mission, and he's going to school right now, and he acts normal, and he just has a little bit slower processing in school, but no more than someone who didn't understand the material. And I really just wanted to point out what one of the messages was in the books, and it said, many behaviors can be changed with highly structured behavior support programs. And I think that's so true, and I know that this was the case for my brother, and it may not be for all people with autism, but that if we do our best and if we try to help them and teach the way that they learn, that it will change their lives and change how they act and the people that they meet and the situations they're put in. And here are some of our resources, and that is our presentation about autism.